Welcome back to DunsHospice. My name is Nurse Dawn. And I shall be your hospice RN. Oh, camera shaking. Welcome back, my beautiful people. Come on in. We are going to have discussion. Yes, we are. We're going to have a discussion about end-of-life care. Okay. We are going to, I want to speak with us regarding the first 24 hours. Okay, the first 24 hours after we've decided to put our loved ones under hospice care, like what to expect after within the first 24 hours. Okay. Be sure we are keeping well hydrated, okay? My beautiful hospice family, make sure we are drinking plenty of water. It's very, very important that we are definitely drinking enough water. Make sure we also eat our fruits and vegetables, all right? Very important. But come on here, my beautiful hospice family. I would love to have a conversation with us regarding the first 24 hours, okay, of being under hospice care. All right. I am going to let YouTube gather some of us up. I pray that many of us can be on this live. All right. I'm gonna wait for YouTube to gather some of us up, okay, before I start to talk. In the meanwhile, I'll just check my email. Okay. Okay. So let me know when you're all here. How are we doing today, huh? How are we doing today? I know that the summer is almost over. Oh my goodness, can you believe that? Summer is almost gone. Summer is almost gone. But we are going to make the best out of it, okay? We still have 2 weeks to look forward to. You know? Actually, every day can be summer if you choose to make it. You know, it's all in the mind. Every day can definitely be summer. It's what we choose to make out of it. Yeah. Where are we, my hospice family? Oh my gosh, what's going on? What is going on here? Hmm? What is going on? I'm gonna wait to see if it gets to 5 minutes. Hi, my hospice family. Hello. Yes, you are the first. Hi, I've been waiting. Yeah, you guys are here. I've been waiting for you, my hospice family, to join me. Hello, me too. Omida, I don't know how to pronounce your name. You guys, as you come in, be sure to subscribe. Okay, subscribe and give me a like. All right, I'm so glad you are here with me today. Thank you for saying hi. I appreciate you so much. Does your name mean anything, my friend? Like, does your name have a special meaning to it? Huh? Oh, me too. Oh, Moroccan. You know, I was watching this video about Morocco, and it's like they were saying all these millionaires and billionaires, okay, live in Morocco. Um, so welcome. You must be royalty. It's Princess, see? Uh-huh. I love to watch like exotic places, because I envision myself traveling there, you know? I love that. I love that. Yes, it's Princess. Welcome, welcome, Princess. Welcome. I am glad you're here with me today. I am so glad you're here with me. Thank you so much for being here. All right. We here at Duns Beautiful People, we talk about end of life care. My name is Miss Dawn. Oh, thank you. Mwah. My name is Miss Dawn. I am a hospice registered nurse. All right. I'm a hospice registered nurse. I've been a nurse for 16 years now. Okay. Very, very long time, my friend. Okay. And I've been doing hospice for 14. And I started this channel so that I can encourage. You see, I really wanted to encourage caregivers. I want to encourage family members because a lot of people don't know what to do when they find that their loved ones is dying, when they find that their loved ones has a terminal illness. So my channel is here to uplift the masses, you see, to encourage us, to give us some tips, some knowledge on what to expect when your loved one is at the end of life. So thank you for being here. Welcome, welcome, welcome. Yes, guys, we are going to talk about what to do. All right, I am live. Hold on, guys, hold on. Yes, my beautiful people. Hi, Minas, firsthand. Thank you for being here, guys. Please support this channel. Help me to grow this channel. Make sure you subscribe. Okay, subscribe and give me a like. As you comment, I'm gonna ask that you subscribe and give me a like. Okay, my beautiful people, please, please. Mina, perfect. Yes, yes. I'll call you Mina. Hi, Mina, and hi, Princess. All right. Perfect. Call me Miss Dawn. I am Nurse Dawn. Nice to meet you, okay? I am Nurse Dawn. Oh, wow. How do you pronounce that? That is so beautiful, though. I'm not even going to try to pronounce it because I don't want to mess it up, okay? I'll just call you Princess and Mina. Oimi. That is pretty. Oimi, yes. But yeah, so when we sign our loved ones, thank you for having a good sense of humor. I appreciate that. I appreciate that so much. Okay, so when we sign our loved ones under hospice care, first of all, who among you watching is familiar with hospice care, huh? Who among you watching is familiar with end of life care? Let me know if you have experience with hospice, if you have experience with end of life care. Like, which one of you have had families, have had people that you have enrolled under hospice care, huh? Let me know if you have had to enroll your mom, dad, brother, sister, your family member under hospice care. Let me know if you have experience with it. But anyhow, hospice means that your doctor say you have 6 months or less to live, okay? So the person has a terminal illness that has no cure, whether it's cancer, whether it's heart failure, it's kidney disease, you see, it's Alzheimer's, dementia, you know. So your diagnosis that you have, there's no treatment for it, and that your doctor has done all that they can do, and despite that the illness keeps on growing, you see. And so now the doctors say, well, the best thing to do is to go home and die peacefully, you see, is to go home and focus on quality of life versus quantity of life, okay? All right. And so that's where myself as a nurse comes in. You see, that's where myself as a hospice nurse comes in. And so this video right here, I want to talk to us about the first 24 hours. You see, like what to expect within the first 24 hours, you know, from the moment you call hospice, the hospice nurse comes in, okay, till the next day. Okay, my friends. So when the nurse comes in, the hospice nurse, the admitting nurse will come in. She will do a complete assessment, like a head to toe. She'll ask the caregiver questions, okay? And he or she will determine that the member, that the patient qualifies to be under hospice, you see? And so once that determination is done, like once she has, you know, followed the guidelines, because Medicare is who pays for hospice, because hospice for the most part, it's 100% free. You see, there's no cost to the family. So once once the nurse determined that the patient qualifies, okay, she will most likely order what we call a comfort kit, you see. So she'll go over the medication list with you. She'll ask you to, you know, pull out your current medication. She'll go over the medication list. She'll go over, you know, the diagnosis and let you know who's part of the team, and also what to expect, you know, what to expect and who's part of the team. All right. And then of course she'll also order a comfort kit. And I think I've made videos about the comfort kit, but I could also make other videos about that too. You know, the comfort kit, it consists of medications that we give to our patients to help them to be comfortable, you see. Now, these medications that's in the kit, it doesn't mean that you are going to take them. It doesn't mean that you're going to take them all. It's as needed. You know, it's things like morphine for pain, lorazepam, Ativan for anxiety, medication for nausea, for vomiting, for constipation, you know. So there's different medications that's in the kit. Some people will use them all, and some people might just might just, you know, use one, you know. And so that's a comfort kit. And so yeah, so she'll order the comfort kit for you within the first 24 hours. That's usually our guidelines, okay? There's something in my mouth, guys. Hold on. I was eating some peanuts before I called, before I started. I was having a snack. You guys, tell me about your favorite snacks. Like, what's your favorite snacks? I love fruits. And I love like peanuts and like cashews, okay? So those are my favorite, some of my favorite snacks. Okay. Cashews, you like that too? Huh, princess? Okay, good. Yeah, I like that. Although I have heard and read that they have so much fat and calories in them. And that's probably why they taste so good, because they have so much calories in them. Your favorite snack is chips and apples. Oh, that is, apples are very healthy. I'm trying to definitely, you know, eat more fruits. And what's your favorite fruit, guys? I do like apples too. But I also like watermelon. Oh my goodness, I love watermelon. It has so much water, and it's also so juicy, you know. But anyhow, getting back to the video, thank you for sharing. So she'll order the comfort kit. Not only will she order the kit, oh, seaweed is super healthy. You are a healthy person. Good for you. Oh, that's good. She will also probably order equipment like a hospital bed. All right, if your family needs a hospital bed, she'll get a hospital bed. The hospice nurse will probably order like a wheelchair. Okay, if your loved one needs a wheelchair, she'll get a wheelchair for you, a bedside table, a commode, because most of our hospice patients, they are bed bound, you know, or they have very limited abilities to move and walk, and so she'll order a bedside commode, okay, so that you don't have to walk to the bathroom, so that the patient can just, you know, do their business right there. Any supplies too, like supplies like depends, wipes, those are the commode. Thank you for asking. A commode is basically like a basin. It's like a basin that people put next to their bed so that they can go to the bathroom, you know. So for people who are sick, who cannot walk, the family will buy a commode, and they'll put it on the next to the bed. And so if they need to pee in the middle of the night, okay, so rather than walking to the bathroom, they'll just use the basin right there, you know, to go. And you could, and also, my friend, I have a website on my description. It has a list of products, you know, that would be helpful for families, so you could go check it out after the video. Bye, Mina. Thank you for coming. Mina, make sure you subscribe, okay, and come back again and talk to me, okay, my friend? All right. Hey, Stray. Hi, Stray. How you doing? Thank you for coming. Thank you for being here. I think I've seen your name before, if I'm not mistaken. Yes, thank you. You guys say bye to Mina. Yeah, she was nice. Hi, Stray. Thank you for being here. Thank you, Mina. Thank you. Yay. We have another person in the family. The family is growing, guys. I am so excited. Everybody say hi to Stray. Stray is new. He or she has joined us. I'm not sure if Stray is a man or woman, but Stray has joined us. Okay. But yeah, so that's what a commode is. A commode is basically, thank you, Omi. I appreciate you, my friend. Mwah. So a commode is basically like an equipment. It's like a basin, you know, that we put next to the bed, and so that the patient can go in the middle of the night or throughout the day. If they have to use the bathroom, the family can just help them, you know, from the bed to the bathroom, so that they don't risk falling down, because some of them, they cannot walk, you see, and so that's very important. The other thing, let's see. The other thing within the first 24 hours is that the family may most likely have questions, you see, and so the nurse will leave with you the phone number to the company, because hospice care is a service and we are open 24 hours. You're welcome, Omi. We are open 24 hours, 7 days a week. It's a service that we provide to your family member who's dying. And so if your family member has questions after the nurse has left, there's a phone number there where they can call and speak to a nurse at any time. Even if it's 2 in the morning, they can call and speak to a nurse at 2 in the morning to help them out, okay? And so that's what you're going to also get within the first 24 hours. So you will get a comfort kit, you'll be admitted, get a comfort kit, you'll have the equipments to ordered for you, You also get to know the number of who to call if something were to happen in the middle of the night. You also know who's gonna be your team, you see. So they'll also tell you who's gonna be the nurse, who's going to be the social worker, you know, things like that. And also keep in mind too, the next day, the very next day, one of the nurses will make a follow-up visit. Make a 24 hours we always make a 24-hour visit to you, you see, so that you're not left feeling like, oh, what do I do next? What's going to happen next? Okay, so I want you to really understand that, my beautiful people, that we absolutely want to make you feel as comfortable and as home as possible. Okay, so that's usually what we do within the first 24 hours, is that we really help you to be comfortable. We really help the family to have all of their to have all of their questions be answered, you know, because we really want to make you feel like we are here for you. We are an extended part of your family, because when you have somebody who you love so much who's dying, it's pretty scary. It is scary, it is confusing, you know, because most of us are trained on how to make people feel better. But what do we do? What do we do when the person is doing the opposite? Do you know what to do when somebody is dying, when there's no cure? And that's where hospice nurses like myself, it's a great service. My friend here says, you want to be a nurse or a lawyer? Good for you. Those are very two wonderful choices, you see. I'm sure you'll be great, whether it is a nurse or a lawyer. Hey, Nathaniel. Hey, Nathaniel, thank you for being here. Is what a nursing home, my friend? Is what a nursing home? Huh? But yes, so within the first 24 hours, the families, they usually have lots of questions. They don't know what to expect, you see. So we want to make sure that we are definitely there for the families, that we allow the communication to be wide open, so that the person feel that they are being serviced, you see. It's really important that the person feel that they are being taken care of and that they are being serviced. Okay, all right, my husband's family. So I'm actually not going to stay too long, you know. I just wanted to come out here and talk to us about that. All right, once again, my name is Nurse Dawn. My name is Nurse Dawn. Thank you for being here. Thank you so much, Omi, for keeping me company today. I appreciate you. And my other friend, Mina, I appreciate you too. Okay, but like I said, this channel right here teaches us, and it uplifts and empowers the caregivers on how to be on how to better take care of their loved ones under hospice care. If you have any questions, please reach out to me. Follow me. I'm on TikTok. I'm also on Instagram under DunsHospice, okay? All one word, all right? So thank you so much, guys, for being here. Be sure to subscribe, like, and I will see you in the next video. Hit that notification bell so you'll know each time I am live, okay? Take care.